Welcome to the 8 Minute Rule podcast, where actual physical therapists share clinical pearls designed to create conversation around what's getting results in the clinic. No fluff, no Medicare stopwatch, only quality content.
Welcome back to the 8 Minute Rule. I got Drew and Mark here, ready to rock and roll. Today we are talking about posture, so get excited. What I want to start us off with, about a minute for each of you guys. What are your thoughts around, does posture cause pain? Start my timer up here. And Mark, why don't you start us off, bud?
I think, the simplicity of that question is, does posture cause pain? And I think the answer is no. I think that form dictates function, which means that posture can inform what may help me understand what's going on with the patient. But in isolation, I can say with pretty good confidence that there's a lot of evidence that actually refutes that posture causes pain anyway. So, yeah, that's it.
Short and to the point there. All right, what do you think, Drew?
I was going to say even faster and just say no. You've got 59 seconds back. But if you want further, I think, again, it can be somewhat correlated with pain depending on what the diagnosis, where they're feeling it. It can inform what I want to look at, but correlation doesn't always mean causation. You know, the typical saying that you go around when there is a correlation.
Yeah, I'm going to play devil's advocate a little bit here. I mean, because, somebody that does a lot of repetitive bending and stays in a extremely flexed position and ends up coming out of that and having pain, could you say on some level that their postural position had an effect on their pain? I think there's a little bit of a chance to kind of look at it from both sides of the coin to some degree. What's challenging here as well is that what I recognize is that there are a lot of studies out there about, does forward head cause neck pain? We don't see a perfect correlation from it, and I don't think there's a magic cure to fixing that either. But I do think there's a place to probably look and say, like, all right, is there something that maybe exists here? I don't know if you guys got any thoughts on that.
I mean, I think, correct me if I'm wrong, it sounds like what you were kind of referring to is almost like a directional preference. Like, okay, if someone has an acute radiculopathy, lumbar, let's say, sitting in a car is usually terrible because the car positions them in a lumbar flex position. And so in that moment, that's something that I would definitely try to address and try to, but more so because I'm trying to put out the flames and treat like the source of what's going on, not necessarily because that posture is bad or like that posture is what's causing them to be in like having their problems.
Yeah, I think there's definitely a difference between the causing, being associated with, and like it in itself is pain. That doesn't mean it's not important. The importance and causing it can be two very different things, because posture may be something that I definitely address, and there are times where I do, but causes it, I'm still on the no side.
Yeah, I think that's fair. Now, I know each of you guys have worked with patients before that come in, like, I got terrible posture, and that's and they believe that is why they do have pain. So just kind of a thought around that. How do you approach conversation around the patient that is kind of convinced that posture is causing their pain? Your thoughts, Mark?
I mean, I usually use kind of the extreme example on the like for posture side of things. Like I usually am like, all right, if I'm sitting in my chair, with absolutely perfect posture and typing on my computer and like all this all day, I'm still going to be uncomfortable. And usually people can kind of resonate with that because it's like, if I sit in one position for too long, I get uncomfortable too. Like it makes sense. And so I usually use that kind of extreme, like, oh yeah, you have perfect posture, quote unquote, perfect posture, but you still have discomfort. And usually that opens the door for them to understand that like changing positions, moving throughout the day, all of those things are going to be helpful. I'll also use the example because by this point in time, they usually have seen me in the clinic, and half the time that like the adjustable desks are not tall enough. So I'm sitting there crunched down and like typing and like, especially now dictating to the AI documentation, like I'm real close to my computer so nobody else hears what I'm saying and all this stuff. And I use that as an example to say, hey, I recognize that's not textbook posture, but I'm also changing positions and moving throughout the day. And that's what keeps me healthy and pain-free.
Sounds like you need an ergonomic assessment there, Mark. Drew, what do you think?
Well, I was just thinking about the 50% of my patients when I ask about goals, and they're like, well, I want to improve my posture. I'm like, how do I go about it? And I usually say, kind of what I said before. It's important when it's important. There are times when it can affect the amount of symptoms that you're having, and you can use it to modulate symptoms and decrease irritability, calm things down. But I use a similar metaphor as Mark, but I'll usually grab a 5 or 10 pound dumbbell and hold it over my head. If I have it stacked straight up, I could probably do this for a while, but eventually it would still be painful. If I held it out in front of me at like a 60-degree angle, I'd get fatigued really quickly and I'm going to get pretty sore, which means there's an amount of tolerance for stress and loading that our tissues can handle, which, side note, can be affected by things other than just, mechanical forces. And there's positions that can make it easier to hold, or you can be in those positions for longer periods of time. But eventually, if you stay in those positions, you're still going to get kind of sore and stressful because you're still putting stress on certain amount of tissues that if you want to change and offload them, like you got to move frequently. That's why our bodies were made to move.
I could be wrong, but it sounds like you just made an argument for posture causing pain.
No, I did not. The posture can affect it because the amount of load on different tissues can be affected by it. You can also build tolerance for it too. So the posture in and of itself
100%.
is not it. Don't put words in my mouth.
Absolutely. I think one of the phrases, I don't remember who said it, you guys may know, but like, what's the best posture? And it's the next one, right? And just that kind of moving around from, I would much rather you worry about changing position. We've all been asked, should I use a standing desk or should I use a sitting desk? And I don't really want you just to use any of them. So, keep yourself moving around is going to be the best option there.
I do have an answer for that. The quote was attributed to the actor Morgan Freeman, though I have not been able to verify that that's true.
There we go.
Little tidbit of information for you there.
Appreciate that one for sure. But yeah, I think all to it, absolutely. As you said, Drew, you can build tolerance. I mean, we got somebody that wants to work in their garden. I probably need to figure out how for you to build tolerance for the flex position in a period of time. Different athletes in different positions, you build load tolerance for what you want to do, and I think that's probably the most valuable direction to go there. So quick, probably only got about 10 to 15 seconds here. What's your best exercise for that patient that could fit in that postural category?
For me, I mean, it's going to be very specific to the patient and what they need to be able to do. To your point, gardening is going to look different than somebody that's doing construction work, adjusting, loading their movement patterns accordingly.
Yeah, similar. I think it depends on what is your aggravating factor and how do you get them out of it. If it's if it's something in the lumbar spine and there's a directional preference, I'm going to focus on decreasing the lumbar flexion. If it's cervical, we're going to try and get them somewhat more ergonomically correct, at a desk or in standing. If it's TMJ, I'm going to look at their forward head posture, and that's probably almost where I look at it the most is some of the TMJ issues I see, but it's going to depend on area of pain and what the aggravating and easing factors are.
Awesome. Appreciate it, guys. Good stuff. Until next time.